Great. So this training is going to focus on the introduction to harm reduction. So what that means and everything that's going on. There is another training happening later on in next week. I think it's Wednesday next week. That is going to be really similar to this, except it's going to be a little different because in this training, I'm going to go through the principles of harm reduction and a few examples. In the training on Wednesday, I'm going to go quickly through the principles of harm reduction, and then we're going to have a few different speakers from the network talk about different harm reduction initiatives that they've been involved in. Everyone will have an opportunity to ask them questions and that sort of thing. So they will be different, and I highly suggest that you attend the training on Wednesday as well if you can. Just notice that the first part will be a bit similar to this. Cool. So what is harm reduction? Sorry?
At what time on Wednesday?
It is at, I believe, 4 p.m. GMT.
At what time on Wednesday? All right, all right.
Yeah, 4 p.m. GMT. I'll send additional message as well to you guys with more info about that, because I'll be announcing the speakers at the weekend. Great. So these are two different definitions of harm reduction.
No problems, no problem.
You have, so the one here on the left is a little bit more popular and a little newer, but I'll go to the one on the right first, and this is cut from G. Alan Marrett, who's known as, he's a researcher from the US who's known as one of the godfathers of harm reduction as a concept, and this is like the kind of the really old original definition of it, which was that harm reduction is a compassionate and pragmatic approach to helping people resolve their problems that they have with drugs. So that's the kind of where the idea of it came from, and where, you know, the original concept of harm reduction came from. But if we look over here at the other kind of longer definition, we have harm reduction is a set of practical strategies and ideas aimed at reducing the negative consequences associated with drug use. Harm reduction is also a movement for social justice built on a belief in and a respect for the rights of people who use drugs. So yeah, this more modern one I prefer personally as a definition of harm reduction, but it's a little bit more convoluted and a bit more complicated. But I'm going to go into like as we go through the principles of harm reduction, you'll understand a little bit more about this, but I'll just kind of highlight a few of the words that are quite important here. So a set of practical strategies. Harm reduction is an entirely practical sort of thing. If it's not accessible to people who use drugs, if they don't use it or it's not working for them, it's not harm reduction. So really, we're really looking at like on the ground being as practical as possible. And then the whole concept is reducing the negative consequences associated with drug use. And it's important to remember that we are looking at a little bit more than just the effects to the person who uses drugs. We also look at the effects of, you know, the families of people who use drugs and the societies as well. So it's a broader perspective, but like oftentimes we focus almost exclusively on people who use drugs and the negative consequences they encounter. And then, yeah, the second part being the social justice movement. So because harm reduction involves the government funding these programs, it involves, you know, fighting for the rights of people who use drugs, it has become a social justice movement. So yeah, it's been just kind of, it's one of the things SSDP fights for, and a lot of our advocacy is fighting for harm reduction initiatives, you know, needle exchanges, HIV testing, that sort of thing. When we go to the government and campaign for that, that's the social justice movement part of it. I'll just stop there for 2 seconds and see if anyone has any questions on the definitions or if it's clear for everyone.
Yes, I have a bit. It's not like a question. Let's say a concern.
Mm-hmm.
All right. With regards the needle exchange programs.
Yeah.
the laws here clearly is against someone doing that practice. And in as much as we have NGOs here that are doing it, but looking at the laws, it's against the law.
Mm-hmm.
And yes, let's say a government has given their consent to reviewing the law. That's why for us in Sierra Leone, we start off by targeting the enforcers, meaning the law enforcers, those in authority, to try and reform the laws. Because until they reform the laws, most of our activities, let's say, it's like a no-go area with regards to the needle and the needle exchange.
Yeah, no, entirely. And I think that's kind of like a really good description of the difference between the social justice movement aspect of harm reduction. So that would be the advocating that you're doing to change the law in order to have access to needle exchange. And then the harm reduction, the kind of first part being the actual harm reduction, which is giving out the needles. I did like a little bit of research to see harm reduction in Sierra Leone a little bit. There is in kind of a few UN documents, Sierra Leone has been accredited for the opening the first legal needle exchange. I don't know the exact complications around the law exactly that happened there, but it's been like kind of well celebrated in the harm reduction community of the opening in, I think it was 2019 or 2018, of the first needle exchange. That was maybe legal or what I'm not sure exactly how it was like recognized, but it was one of the things in the sense that particularly in West Africa, there's like a very limited access to clean needles. So yeah, but yeah, thanks for that comment. Okay, so now I'm going to go into the principles of harm reduction, and that's going to be pretty much all we're going to go through here. There is 8 or 9 principles to harm reduction, and they are like just the ideas of where harm reduction comes from, and like what is the point and what are we doing. So this is the first principle of harm reduction. I'm going to go through this. I have a series of reflection questions for you guys to think about a little bit when you're doing it, as well, just so you can have so you can begin to like tackle your internal bias around people who use drugs, looking at stigmatization, and also making sure that you're understanding completely the concepts. So the first principle here is accepting drug use, legal or otherwise, as a part of our society, and then choosing to minimize the harmful effects rather than condemning or ignoring drug use. So this is just the classic, it's almost basically the definition of harm reduction, but this is like a nice introduction to it. I guess helpful things to note in this thing is that when we talk about drug use, that we're also talking about legal drug use or prescription drugs, or drugs you might get from your pharmacy. So it's not necessarily restricted to just illegal drugs, which is oftentimes the perception of it, because lots of people abuse legal drugs like alcohol and cigarettes and prescription drugs, that they might get from their doctor for pain or whatever. And the abuse of those drugs is also you can include it in the principles of harm reduction. And yeah, so we're choosing to minimize the harmful effects of drug use rather than condemning or ignoring drug use, which is like the more common tactic that the governments tend to take. I'm just going to see. So I have a question for you guys to reflect on and think about a little bit, but and you don't have to answer this out loud. This is kind of for you to personally do. I'll also send you these questions afterwards if you want to go through them again yourself. But the first question I have to reflect on is, how have you seen drug use in your community?
Yes, that's good.
Sorry, did you have a question?
It's a concern. I think you said you'll forward the presentation to us, right?
Yeah, I sent it into the WhatsApp chat, and it's in the chat for the Zoom call as well there.
All right.
It's a link. It's on a Google, you know, on the.
I was actually taking down notes.
Yeah, you can take notes, but like as
I
well,
was
it'll
actually
also
taking
be
down
here.
notes, but I see. Yeah. So the materials will be helpful. I need them, and
Yeah, and you'll see at the end as well, I have links to all the resources I've used and a few additional helpful like resources for different areas and things that'll come up as we go along as well. So you'll be able to find kind of like the source material as well if you want to kind of go more in depth. But I'm gonna stick here on this one. So the first question I have for you to reflect on is how have you seen drug use in your community? And I'd like, particularly if you guys can maybe think a little bit about how you see drug use, maybe that's not as what, maybe broaden your ideas of what you might consider drug use and drug abuse, and like think about legal drugs that people might abuse and that sort of thing as well, just as a helpful way to like broaden your mind of what we're talking about here, it not being just maybe specific to certain drugs, you know. But yeah, so that is the first principle. We'll go into the second principle of harm reduction, and after we go through this one, I'll stop for questions about like the principles themselves. So the second principle is understanding drug use is a complicated thing, and that includes, understanding drug use is a complicated thing that includes a wide range of behaviors from high usage to total abstinence, and recognizing that some of the ways of using drugs and recognizing that some ways of using drugs are safer than others. So I guess what this principle is trying to say in general is that drug use is really, really complicated. Why people use drugs and how they use drugs can vary drastically, from somebody drinking a coffee every morning to somebody using heroin and a range of other drugs, you know, 15 to 20 times a day, you know? So it can be really, really varied. And the reason why it varies can be extremely personal to the individual, and recognize as well, like, you know, all of those different types of use like have different effects on a person, and recognizing that some specific ways of using drugs are safer than others, because if you're using, you know, for example, if you use heroin, that it is definitely safer to use clean needles than it is to share needles with other people. So we recognize certain methods of using drugs are better than others, but always coming back to this idea that it's complicated and extremely personal, why and how people use drugs. So yeah, that's the second one. I'll go into the reflection question I have here. So the reflection question I have here is, have you considered the idea of using drugs safely, and have you ever seen people use drugs in a safer manner? It's a really important thing to reflect on, because I think a lot of the time, at least for myself personally, when I started getting involved in this type of work, was that I thought that it was always going to be dangerous, and there's, you know, that certain types of drugs were really dangerous and others weren't, and my perceptions of that have changed a lot as I've seen different people use drugs in different ways and safer ways. So yeah, just reflect on the idea. Have you ever seen people try to
sorry,
use...
can you go?
Yeah.
Sorry, can you go over the last reflection question again?
Yeah. So the question is, have you considered the idea that drugs can be used safely? And just to think about that a little bit, if you have or you haven't, but like to think about the safe use of drugs. I always find a really nice place to start with that is if you think about the way people might use like maybe prescription medication or alcohol or something like that, and they use it in a safe way and they aren't hurting themselves, and maybe thinking about, can that expand to other drugs? So that's that reflection question. Do you have any questions about the first two principles?
All right.
Okay.
Yes. Let's say the second principle.
Mm-hmm.
Understanding drug use is a complicated thing that includes a wide range of behavior from high usage to total abstinence. Recognition and some ways of using drugs are safer than others. What I, that one is not too clear to me. I believe the use and misuse of drugs absolutely are just the same.
Yeah, so
It's either you use it the correct way or you misuse the drugs. Even let's say the drugs name useful drugs, they can be misused.
yeah.
Let's say, for example, Panadol and the likes. If you misuse it, if you take an excess one, you will misuse it. That's you go above the prescribed dose, you will misuse it. So I want you to kind of a bit explain this one for me.
Yeah, so basically when it comes to the difference of use and misuse, we look at a few different things, and it is something that's generally not very well defined or globally agreed upon about the difference between use and misuse of drugs. But so we have different types of drug use. You have like habitual drug use, which might be, related to addiction or dependence on a drug. And then you also have recreational drug use, when people use drugs just as a hobby or like, occasionally or whatever. You can have drug misuse in both of these categories. And you can have drug use in both of these categories. So there's lots of people who functionally use drugs every day. In a way that doesn't interfere with their life in a massive way, and is totally fine. So, for example, people who drink coffee and it doesn't keep them up all night. They just drink a cup of coffee in the morning and they're fine and they go about their day. That would be a normal way of using coffee. And then you have some people who will misuse caffeine, right? They might drink coffee, they might drink 5 cups of coffee, they might not be able to sleep all night, and then they're wrecked and they can't go to work the next day because they're too tired, and that would be a misuse of caffeine. And if you think about that with other drugs, that totally exists. So yes, with Panadol, you can use Panadol in the correct way or you can use Panadol incorrectly. The definition of what is correct it's really variable. It can change a lot because yes, there is what it says on the prescription, but when we're talking about legal drugs or are using drugs in different ways than what they're prescribed for, the definition isn't very clear because nobody's agreed on it and nobody will talk about it, because if it's not written on the box, the government is like, it's terrible. But that's not necessarily the case. So there is different types of drug use, and there's people who use heroin and have a functional life, who can go to work every day, who can still enjoy an entirely fruitful life. What's important to like kind of note in this principle is that using drugs correctly, the definition of what that isn't extremely clear. And there is safer ways to use drugs than others, but we can't necessarily judge the individual because we don't know what's safe for them, and as well we don't know what sort of kind of restrictions they're living in. But yeah, so it can be really variable, but there is ways to use drugs safely, and there's definitely ways to use drugs more dangerously. I would say it's not as clear of it can be very difficult to be like, well, that one's safe and that one's not, because there's always a risk involved. Even if you're taking Panadol, like as prescribed perfectly, you might be allergic to it, or there's still risks involved. There's still things that might happen. And there's nothing we can do to absolve all those risks, because there's risks involved in absolutely everything you do. When you walk outside your house every day, you might get hit by a car. And that's a risk, but we do things to take away the risk that you might be hit by that car by making sure that you look across the road and you walk on a path or in the correct place or whatever it is, like on a sidewalk or something. So there is still risk involved, and in my personal belief, it's kind of more of a spectrum when it goes from you know, functional or safe use to all the way up to, you know, into total abuse or misuse of drugs, because basically it's just how much risk is involved, and that can vary a lot. But yeah, and I think that's what this principle is trying to say. It's trying to talk about how complicated drug use is, and like that it's not as clear cut as there's misuse and there's use, because it depends what type of use you're using, it depends what type of drug you're using and how you're using it, and whether and how it's affecting you and your life and your body. And it's not clear cut. There's, you know, you might take one drug and I might take the same drug the same exact way that you take it, but you might be affected 10 times more than I am with your personal life, you know. And it can vary a lot. And yeah, so what this is trying to say is just it's so complicated, and we have to be just aware of the fact that we don't have that perfect knowledge, you know.
Okay.
Does that help, or have I made it more complicated?
Yes. 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 It helps. Yes.
All right.
Yeah, because some people, when you say, listen, you misusing this drug, he will say, listen, I have not even started. This is not my dose. You understand?
Mm-hmm.
So, but it's better. You've made it at least a bit clear to me. You know,
yeah,
some people have their limits, and for some, the limit of the other person is just the starting for them. So you will not tell that person, hey, listen, you misusing these drugs. So everybody has his or her limits. You know,
yeah.
someone would say, when I take 5 Panadol, I will be okay. Someone will say, oh no, I just need to take a single Panadol, then I will be okay. So you see, that's what I thought before asking you the question, you know.
Yeah, 100%. It's the same way as, you know, I might be able to drink 5 cups of coffee, but if you drank one, you might be super hyper. You know, like it affects people in different ways. And like because it affects people in such different ways, the way people use drugs can be really different.
Yeah.
But we know for a fact that certain ways of using drugs are safer than others.
Yeah.
Coming back to that example of, we know that sharing needles is dangerous. We can guarantee that. So we know that that's something that we need to try to help people not do. So yeah, so that's what that one's about. I'm going to go into the, just as a reminder. So yeah, I'll go into the third one now. So the third one is really important. This is kind of where my personal, this one kind of helps me understand harm reduction in the best way. So we consider the quality of individual and community life and well-being, not necessarily stopping drug use, as the criteria for success. So what we're saying here is that we are considering the life of, you know, the life and well-being of the community and the life and well-being of the person who uses drugs, you know, getting that to the highest point as we possibly can, being our criteria for success in harm reduction. And that might include stopping drug use, potentially, but it doesn't have to include that. And oftentimes it does not include stopping drug use. So I think this is really important to keep in mind when you're doing harm reduction, and it's something I try to keep in mind when I do harm reduction, is, you know, is the steps that I'm doing right now to help that person going to increase the quality of life of themselves, or the well-being of that person and the well-being of the community? Or is it just going to cause more confusion or stop them doing other practices or whatever? Because that can happen. So we're looking at maximizing quality of life and well-being of the person themselves who is using drugs and the community. And that's really important. So yeah, so not necessarily stopping drug use. So for some people it is stopping drug use, and for other people it's not. That's why research is really, really important in this, in harm reduction. At the end, I have a series of resources for you to take a look into. That is, there's a lot of research, peer-reviewed research on different types of harm reduction and whether abstinence, because abstinence works for some people, but it has like a relatively it's not a 100% success for every single person who gets into it. You know, stopping drug use doesn't work for everyone. And for a lot of people, they may stop using drugs initially, but they might relapse, and it can be really difficult after an abstinence-based program to deal with the shame of relapse. But that's one specific thing. But for some people, it does work. And so what we're saying is we'll consider all the different options and that includes drug use, to make sure the quality of life and the well-being of the individual and the community is taken care of and is getting to the maximum it can possibly be at. My question for you guys all to individually reflect on is, how are you defining success as an SSDPer and in the work you're doing? And like, would you consider your work, you know, is this how you would have framed your success, or maybe it was different? And then as well, the second one is consider the idea of functional drug use. So that is people who use drugs regularly and still have a happy and contentful life and are having a great time. You know, like, who are living in a functional way. It isn't disrupting on other people or their lives massively. So I was just thinking, consider the idea of that. Consider if you've seen it before. You might have seen it with illegal drugs, but maybe you've seen it with legal drugs as well. I always come back to, we all usually know somebody who drinks coffee or drinks alcohol and is a normal, fine person who can function in their life. We also all know people who don't. So you see both sides of that. So any questions on the third principle there?
No, I think this third principle is clear. This is
Great.
clear.
Brilliant. Let's go into the fourth one. So harm reduction calls for the non-judgmental, non-coercive provision of services and resources to people who use drugs and the communities in which they live in order to assist them in reducing harm. So I know that was a lot of words and a lot of stuff there, but I'll take you through what's important and what we're trying to say here. So we call for the non-judgmental and non-coercive provision of services. So we're talking about services, predominantly health services, but predominantly harm reduction services so these services are services that help people use drugs in a safer way, or perhaps maybe help them use them less so, or change their drug using habits, right? And we need them to be non-judgmental. As I'm sure all of you know, people who use drugs are one of the most stigmatized populations. In order for people to be able to confront their drug use and figure out how to use drugs in a safer way, particularly because drug use is illegal, they need to come into a space where they know they're not going to be judged. They know that they're not going to be put into prison, or a policeman's going to be shouting in their face, or that they're, you know, sometimes people need those services to ensure that their family won't find out about their drug use and that sort of thing. So in order for people who use drugs to use these services, they need to be non-judgmental. So they need to be this open and accessible space, and for such a large space of reasons, which I'm sure you guys understand. Non-coercive, so what that means, so non-coercive provision of services means that we are not trying to coerce people into using these services. So we're not trying to pressure people, we are not trying to convince people to use these services, we're not trying to require them to use them. So what that idea is because we've seen in coercive provision of services, it's oftentimes government mandated. Some of you might know about the forced rehabilitation in Nigeria, which has involved some really horrific things such as torture and all of these sort of things. But like, where people who use drugs were required to go to these locations, they had no choice they had no choice but to go into these services. What has generally been found with this situation is when people are forced into these services, they tend to be significantly less successful. and you're putting a person who's already highly stigmatized in an extremely hostile position because they have not chosen to be there. They will be aggressive, they will be angry, and they will be extremely uncomfortable. And generally with coercive provision of services, what we see is that they tend to be focused on abstinence of drugs. And they tend a lot of the time not to be particularly helpful, in the sense that they tend to involve a huge amount of shame, whether it be religious-based shame or otherwise. But they will also, you know, tend to be very, they tend to be ignorant of the kind of pain those individuals are going through, because withdrawal from a lot of different drugs can cause a huge amount of side effects on the body. Oftentimes, people can die from withdrawal of drugs if you do not, you know, if you've been taking a certain drug for a long time. There's certain drugs that if you stop taking them, you can die from things like dehydration, oftentimes starvation and stuff like that, because your body goes through a huge amount of serious things. So ensuring that we're in a non-judgmental, non-coercive provision of services means that people are optionally going into these services, and they're not being judged for being there. So those two aspects are extremely important. And then, yeah, so that's the idea in this one. So, and also that we're looking at beyond just people who use drugs, we're looking at communities in which they live in. And the whole idea is that we are supporting and assisting people reducing harm. We are not forcing people to be involved in these situations. It's just been seen that these sort of kind of peer-based supportive spaces have been far more effective than any form of like coercive or forced upon government regimes surrounding rehabilitation and stuff like that. Because people will just resist what they're forced into, especially when they're forced into by the government, because positions of authority can be very difficult to deal with if you're a person who uses drugs and you're highly stigmatized. So I will go into the, oh, I didn't have a question to reflect on here, but I'll add one now. But with this one in particular, oh, sorry. I did have a question. I was like, think on the idea of non-coercive provision of services and what that means in practice. So when we're talking about not non-forced and not kind of trying to convince and push people into services, what does that mean? And how does that work effectively? So I suggest you think about that a little bit. And I also think for this question, it might be helpful for you to do a bit of research, get on Google or Yahoo and search a little bit about the idea of non-coercive provision of services. If you look at some of the Canadian harm reduction services, they've been really, really adamant on that specific item, so they can be a good resource to look at. But does anyone have any questions on this concept?
Not for me.
All right.
Yes, hello.
Yeah, please go ahead.
Hello?
We're getting you.
Ibrahim, go ahead.
Maybe
let's continue.
Yeah, maybe Ibrahim, you can put your question in the chat function or something like that, since we can't hear you right now, and I'll come back to you if that's okay.
Hello. Can I make my own contribution?
Yeah, please.
Hello. With
Yes,
this
please
call,
go ahead.
what about now if we have laws within our country has already provided coercive action, actions in our country. How can we implement harm reduction without coercion and judgmental? While there are provisions already in our laws for this coercive and judgmental seen as drug users, how can we navigate between implementing harm reduction that is not coercive or neither judgmental, but also there are provisions within the law that make provision for judgmental and coerciveness for drug use.
Yeah, totally. I'll give you an example of there's just, I am going to talk about this one because I know about it specifically. But in Ireland, there is a service called Merchants Key Ireland. In Ireland, we have a huge amount of people who use heroin. And one of the, so they provide a series of different services, including needle exchange, but they also have nurses and doctors there to basically help people who use drugs be able to access that sort of thing. But basically, the way that they're a non-coercive, non-judgmental group, and the way that they implement that is that they are set up and they spread through word of mouth. So they have this facility that is in the Dublin city centre, but what they do is they go into communities of people who use drugs, and then they will, provide them with food, water, blankets, whatever the things that they need, just kind of your basics. And they talk to them because generally in Ireland, there's a large population of people who use heroin who are homeless. So what they'll do is they'll go and give them some of these resources, and they'll talk to them, and then they'll ask them if they would be interested in coming to the facility. They make sure that it's totally optional for that person. But what they do is they make a really big effort to gain the confidence of the population and of that community. So by being out in that community, coming out to them, not forcing them to come to you, and talking to them a little bit about their experiences. And what they've done as well is that they've made sure that these initiatives are, they center the needs of the people who use drugs. So it's not necessarily people who don't use drugs who are making all the decisions. They invite those communities in to make some of the decisions about how those services are run and how they work. And that's another important aspect, to make sure that these services are, it can be really difficult to get to that position, especially in countries where the stigma is extremely high, which I know it is in Sierra Leone. And it took Ireland a really, really long time to ever get there. But being able to gain the confidence of the community, make sure that word is spreading through word of mouth amongst that community, and that it's an option for them to go there. It's not a forced thing, but making sure that you are serving exactly the needs that they want, and you're giving them what they want to be taken care of. So that's one of the ways. And then making sure it's non-coercive is just making sure it's optional, that it's not enforced by the government, or nobody's telling them they have to go there. Just making it an option, because if you are providing a space that's safe for people who use drugs, that is comfortable for people who use drugs, and that is providing them with the services they need, they will come, But a lot of it's about gaining the confidence of the community. So I hope that answers that question.
Yeah, thank you. Thank you very much for that contribution.
Yeah, no problem. And as well, I'm just describing that one. A lot of interaction with that one in Dublin. But that sounds like it's really big scale and stuff like that, but it can happen on a really small scale, gaining the confidence of the community and stuff like that. It doesn't have to be a huge organization to make that happen. But it means that you have to be, able to go into those communities and talk to them honestly and hear what they're saying and take it on board. And you have to be ready to change how you work in order to suit them and make sure that their needs are heard. Because it's so much about gaining this confidence and then being secure and comfortable in the space. All right, I'm going to go into the 5th principle. So ensuring that people who use drugs and those with a history of drug use have their voice centered in the creation of programs and the policies designed to serve them. So that's really similar to what I was just talking about there, and that's how you get to the point of non-judgmental, non-coercive, is making sure that these are designed by the people who use drugs and making sure that their voice is in the center of this kind of creation process. And And yeah, it's quite simple. It's a lot more simple than it is to actually do in practice. But it can be done. It's been done across the world. If you want to see a few examples about how this has been done in different places across the world, the International Network of People Who Use Drugs have just released a fantastic documentary called Taking Back What's Ours, or Taking Back What's Ours, so ours, sorry. And it's a 10-part docu-series. It is on YouTube and also on the Input International Network of People Who Use Drugs website. And it goes into the history of the movements of people who use drugs. And you will see there how these movements have developed in different countries and different regions, and basically where they came from and how people who use drugs have organized in order to create programs and policies like this. So I think that's a really good resource to kind of understand what this looks like in practice. I'll send you a link in the WhatsApp chat just after this, if that's all right. So does anyone have questions about that? All right. So the sixth principle is so harm reduction emphasizes that people who use drugs themselves are the best way of reducing the harms of their drug use, and seeks to empower people who use drugs to share information and support each other in strategies which meet their actual conditions of use. So that's a bit of a mouthful, but what we're saying here is that people who use drugs tend to trust other people who use drugs. Understandably enough, as you would imagine, if it makes sense, you would trust your peers before you trust anyone else, particularly if you are from a marginalized community like people who use drugs. Your trust for authority, for the government, for other positions of authority is quite low because you've been highly stigmatized for a very long time, and it's very hard to have trust in governments that work against you, or even in just positions of authority in general as well, because it's a societal attitude. So people in society also aren't necessarily supporting you, so you might not trust them. So what we're emphasizing here is that people who use drugs themselves are the best way to help reduce harm. And we want to make sure that people who use drugs are sharing this information with each other, harm reduction information, like things like how to inject safely, how much of a certain drug to take at a certain time, or what's too high of a dose that might kill you, like that's important information for people who use drugs to know, and we want them to share it with each other. And basically we want them to use strategies which meet their actual conditions of use. So some people might have a specific idea of how people who use drugs use their drugs, but they'll use them different, and different people use drugs differently. Because you might, if you're using heroin, you might use it extremely different the way people use cocaine or use cannabis. All of those things, all those drugs, used extremely differently because they're very different. And also if you add in like what sort of living conditions you're in, what sort of pressures or stressors there are in your life, you'll use drugs differently. So what we're saying is that people who use drugs have such an in-depth knowledge of how they're using drugs and how different drugs are used, that they are the ideal people to help develop those strategies for how they're using drugs, because they know, they have the perfect knowledge about it. They know more than anyone else does. So that's what's really important here. And this is actually, so SSDP's peer-to-peer drug education program. That's where the peer-to-peer aspect comes from. Our idea with the drug education program is that you'll learn to use drugs, or sorry, not learn to use drugs, but like if you are in college and you have friends who use drugs, you are much better to talk to them. If we educate you on how what safe drug use is, or how to talk to people about drugs, you are a much better person to talk to your peers in college, like other students, about drug use than maybe a teacher might be, or maybe a lecturer might be, because you know, lecturers are much harder to talk to, and they're much more distant from the experience of a student. Then another student knows it. You understand it better than anyone else because you are also experiencing the same things. So that's the whole idea here. It's peer to peer. You know, people who understand each other, talking to each other with these sort of things, far more effective than anything else. Is there any questions on that one there? All right. I have a question for you to reflect on. So the question for this one is just think about the idea of trust and trust in authority and trust in other people. Think about what that might mean for stigmatized communities, for communities that are kind of separated from society, whether, you know, outlined or something. Think about, like, you know, re-envision your idea of what trust might be and think about who could they actually trust, and you know, having that a bit of an idea of like how people use drugs are affected by this kind of stigma and being treated worse off than other people. You know, think about how that affects their trust and who they'll listen to. So that's the question to reflect on there. All right. Let's go into the seventh principle. So harm reduction recognizes the realities of poverty, class, racism, social isolation, past trauma, sex-based discrimination, and other inequalities. We recognize that affects both people's vulnerability to and capacity for effectively dealing with drug-related harm. So I'll go into what that means and what we're trying to say here. So all these things, all the things that are listed here, are things that you know, they cause inequalities in society, and they are inequalities in society, and these also are all different types of stigmatization that people suffer. So people who are in poverty are oftentimes stigmatized. People in different classes, lower classes, are stigmatized because people think they're worse off or they're lazy or whatever the thing is that people think, but they treat them not as well as they might treat, you know, upper class people. Same thing with racism. When we talk about social isolation, that's oftentimes a result of stigma. So, you know, I'm sure you've all seen and heard stories about when somebody, you know, when there's somebody in your town who starts using drugs and everyone finds out about it, and then nobody ever talks to them again. Maybe their family kicks them out, and that's social isolation. So they've been separated out from society, or at least separated out from their support network that they previously. Past trauma. So when people have, you know, been through traumatic experiences before. And then you have sex-based discrimination. So women who use drugs often face double stigmatization or double discrimination, because not only are they a woman who's already discriminated against within society, now they're also a woman who uses drugs. So they're doubling down. They're going to be treated, you know, extra treated. They're going to be treated an additional level of poorly and that sort of thing. So basically what we're saying is all of these aspects that affect to dealing with drugs well, because your mental and also it affects people's capacity to effectively deal with drug-related harm. So what we're saying there is that if you are dealing with all of these other problems that are affecting your mental health, affecting your ability to think, you might be using drugs to self-medicate, maybe your mental health or your physical health. You might be using drugs for many other reasons. but your ability to deal with drug-related harm might be lower because of all of these types of social inequalities, because you're already dealing with a huge amount of pain or struggle or difficulties that you might not just be able to, you know, think about it or start implementing these things in your life because your mental health might not be as well. So what we're doing here is we're recognizing that all of these things are going to affect how people use drugs and their ability to change how they use drugs if they need to use them, if they need to change how they're using drugs, right? And like it might also make them a higher risk for using drugs and suffering from drug-related harm. So like they might use drugs in a more risky way, in a more dangerous way. So we're recognizing that all of these sort of things come into play here, and it's important that we, as harm reduction, you know, people who do harm reduction, it's important that we're aware of that we know that coming in, and we know that though you might not know if this person is in poverty or not, or you might not know if this person has past trauma, but we're sitting there while we're doing our harm reduction and we're aware that these are things that can affect the person, and maybe if they're not able to do the things you're asking them to do, it might not be their fault. It might be because of some of these issues. And like they might not just have the ability in that moment to do what you're asking them to do. And that's okay. And we're going to do our best regardless. Does anyone have any questions about that one? All right. So the question to reflect on here I have is if you could just think about what sort of social inequalities, there's some of them listed here, have you seen affect people who use drugs in your community? Do you think these factors are affecting people's mental health, and how? So I am sure in your communities there's different types of social discrimination and inequalities. There might be, you know, for example, discrimination against young people or whatever. In your society where you're living, it might be different, right? And what I'm asking you to do is think a little bit about how you've seen people discriminated against in your community, and maybe take a look at see how people who use drugs are discriminated in your community, and see if you see any of these kind of connections of maybe, you know, women having to hide to use drugs or whatever. Just take a look at what's happening specifically in your community, and can you identify any patterns? Because that'll be really helpful when you go to do harm reduction in practice. Being aware of that is extremely important, and being sensitive to the people you're talking to and understanding maybe some of the things they're going through. It really can change their confidence in you and your ability to understand what they're going through, and that's the most important. Okay, so the 8th one is harm reduction does not attempt to minimize or ignore the real and tragic harm and danger that can be associated with illicit drug use. This one's extremely important. So we don't want to minimize all of the harm that's happened. We know that many people die from drug-related death, and we know that many people have been hurt by family members, and you know, we know the amount of kind of pain and struggle that people have gone through, and we are not trying to minimize that in any way. We're trying to make sure that less of that harm happens in the future and less of that danger happens in the future. And we want to be sensitive to all of the people who have suffered from the real and tragic harm and danger that has happened from illicit drug use. So is there any question on that one? All right. Let me see. So the reflection question for this one, and I'm going to send all these reflection questions back to the WhatsApp chat just after this, so you guys can take a look and, you know, think about these again, maybe if you want to think about them a little bit more deeply. So have you or people you know experienced harm or danger as a result of illicit drug use? Do you think any of these principles or harm reduction might have helped in those situations? So that's just like a helpful thing for you to look at and see if you think any of these ideas could have helped in that situation. And cool. So that's all the principles all together now. That's the entire set. I have a few little examples, a little bit of information for you now. I'll just stop here now in case anyone has any questions to ask about the idea of the principles or the definition of harm reduction. I know some people have kind of come in and out, so don't worry, this is recorded. So you'll be able to watch this back again. But any questions at all there? Just this section there. All right. So this is just like one of the facts I came up with when I was going through a little bit of information, but just as an idea, people who inject drugs are considered quite high risk, particularly for bloodborne diseases like HIV and AIDS or hepatitis C. But just so you have a bit of knowledge about like types of drug use and that sort of thing, and just to get you started, I'm sure you might be aware of this already, but in 2018, there was an estimated 2.3 million people who inject drugs in sub-Saharan Africa. 546,000 of them were living with HIV. HIV is entirely preventable for multiple reasons, particularly, so people who inject drugs are particularly susceptible to it, as a lot of the times they will use unclean or share needles. And because you are injecting yourself, the blood will transfer over, and dirty needles can cause you to contract HIV, AIDS, and other bloodborne diseases. Entirely preventable with the use of safe injection locations and needle exchange. So that's just like, you know, this is just an idea of where harm reduction can be used to like lower these things like HIV and AIDS rates. And I know like the rates of HIV and AIDS in the overall sub-Saharan African population has fallen drastically with the HIV and AIDS efforts. But what you'll find, and this is across the world, but particularly in sub-Saharan Africa, where there is a lack of access to clean needles, is that basically the rates of, you know, if you're looking at 2.3 million and 500,000 of them have HIV, you're looking at a significantly higher rate of the population of people who inject drugs having HIV than other communities. So it's very important that we look specifically at this community. Here's a few examples of harm reduction. If you come to the session on Wednesday next week, you'll find information about it in the WhatsApp chat. You will find a lot more helpful information. For examples, I only have one little section about people who inject drugs for this one, but in the session next week, there'll be a lot more information, a lot more helpful. So, so harm reduction for people who inject drugs. Here's a few examples of what we mean when we're saying harm reduction. I'm sure you must already know a bit about this, but you have safe consumption locations. This is a relatively new concept, and there's quite a few countries. There's only a few countries in the world that have these. But these are locations where people can take their illegal drugs to and inject them under the supervision of a doctor or a nurse. It's an amazing thing, but it is extremely difficult to advocate for. But I highly suggest that you do if you can, because there has never once ever been an overdose in a safe consumption location. And it is one of the most effective ways of tackling overdose because they're injecting in a really safe way. We can test their drugs if that's legal in that country. You can have Naloxone, which is a drug that can prevent overdose. So basically, if somebody is taking too much heroin, for example, that they could have some naloxone, which usually comes in a nasal spray or in an injection, and it reverses the effects of an overdose. But that though, you could have things like naloxone available in a safe consumption location if needed. So that's one example, and this is a really, really cool thing. I suggest if you are interested in this area that you read into what safe consumptions are like and the statistics around it. It's very impressive. Needle and syringe programs are needle exchange programs. So I think in Africa currently it's quite limited the number of countries, but it's growing every year. If you come to the talk on Wednesday, we will have a speaker who runs a needle exchange clinic in Nigeria who is funded by the Global Fund to set that up. And you'll be able to like listen to how they've done that work, how they got to that point, the advocacy they needed to do to get there. Really, really important, and it's really, really interesting. So bloodborne disease awareness. So this is basically just raising awareness and education around bloodborne diseases. So HIV, AIDS, Hep C, and a series of other bloodborne diseases. It is really important that people know the dangers related, know how to identify bloodborne disease. So the sooner an individual can, get tested for HIV and AIDS, the sooner they can stop spreading it to other people through sharing needles, or they can be more careful and that sort of thing. And we have opioid substitution therapy, which is another form. So this is basically when we use another drug like methadone or buprenorphine. There's a few other ones as well. The use of certain drugs. So this usually methadone's used to substitute heroin. One of the benefits is methadone. When people use methadone, it can help leave the time that they're going to crave heroin again. It can make that time a little bit longer, which is really helpful, and it's also a lot more controlled. So you'll see in different countries across the world, they'll have, in Ireland, methadone clinics, and it's quite common in Europe to have methadone and buprenorphine clinics where it's government supplied. So people can register and access that. But those are just a few types of harm reduction that exist for people who inject drugs. Does anyone have any questions there, or just about harm reduction in general? This really is just like a nice little introduction to like what we're talking about here. And we can go into more specific stuff if we need another training on a more specific area of harm reduction, or harm reduction for a specific type of drug use or a specific community. But yeah, do you have any questions there? All right. So this is probably the most helpful part, I think, after the principles for you guys to look into. We have a series of readings and resources here for you. I will talk to you a little bit about a few different ones here. You can also go through these on your own. You'll find a link to this presentation in the Zoom chat and also in the WhatsApp chat. So basically, these are different. So the Harm Reduction International is a fantastic journal that you'll find about and website that has loads of information about harm reduction, research into harm reduction across the world. You'll find the regional review for sub-Saharan Africa here, and that is generally quite helpful. The regional review goes into specific different details about trends of different types of drugs in different regions, sub-Saharan Africa, particularly relevant for Sierra Leone. So the Declaration of Dakar on harm reduction among people who inject drugs in West Africa. This is particularly helpful as basically it's talking about harm reduction and human rights of people who use drugs in West Africa and like kind of what we're going to do about it. and the recommendations of how that'll work. It's really helpful language for you guys to learn, and also for you to use while advocating. Perceptions and surrounding perceptions surrounding persons who use drugs by Youth Rise Nigeria. Youth Rise Nigeria is another youth-based drug policy reform organization, and yeah, this is just a particularly insightful kind of more regional understanding of perceptions about people who use drugs. As well, if you would like to join the SSDP Harm Reduction Facebook group, it's a really good place to ask questions and learn about resources. You like oftentimes see people posting there asking questions about different types of harm reduction, and it's a good community space because there's a lot of very experienced harm reduction people in SSDP. So a cultural approach to HIV and AIDS harm reduction in Muslim countries. And that's by the Harm Reduction Journal, a lovely peer-reviewed article with a lot of information there, which can, you know, provide a little bit more context about what's happening in Muslim-based countries. Invisible Victims, Drug State and Youth in Liberia and Sierra Leone. This is a really nice thing to look into. It's by the Open Society Initiative for West Africa, so that's OSOA. It's run by it's a subsidiary of the Open Society Foundation, fantastic organization that does a lot of funding around drug policy and human rights. But if you look into this, you'll find a lot of information about kind of how youth specifically have been affected, how the law is affected, and drugs are affected in Sierra Leone specifically, but also a bit about Liberia as well. So really, really helpful resource there. Okay, then we have Model Drug Law for West Africa, a tool for policymakers made by the West African Drug Policy Network. This is a particularly, you guys might already have seen this, but this is a very helpful thing to look through, to look when you're advocating for drug policy reform. There's sections on harm reduction in there. Not Just in Transit, Drugs, States and Society in West Africa, and this is by the West African Commission on Drugs. That's really interesting because obviously, I'm sure as you all know, a huge amount of West African countries traffic drugs through, and there tends to be different kind of attitudes and cultures around drug use and that sort of thing in countries where drugs are often trafficked through. So if you take a look on this report, you'll find a lot of information about, you know, kind of drug state and societies of drugs, law, and the, you know, societal reactions to drug policy and drugs being trafficked through countries there. So it's really nice kind of area of information there. And then Drug Laws in West Africa, a review and summary by the International Drug Policy Network. It should be the International Drug Policy Consortium. This is basically just a big review that was done by one of our really good, so IDPC is one of our really good allies. We're a member of that coalition. And basically Maria Gueretti, who is a good friend of ours and the West African consultant for IDPC, contributed to creating a review of drug laws in West Africa. So it's really interesting. I think it can be really helpful for two reasons. So for you guys to better understand Sierra Leone law about drugs, but also so that you can take a look at how laws have changed in other countries, which can be really helpful for advocating in your own country, because you might be able to find some regional based evidence that can support your claims. So I hope you guys have found this helpful. That's the last bit I have here. I'm going to stop sharing now, but does anyone have any additional questions or anything else they'd like to add, or any comments or anything?
Yeah. Sorry. Just now I lost the audio, so I had to reconnect. I might have lost a bit.
No worries. We've just come to the end there now.
Uh,
But don't worry about it. We've just come to the end there now, but we've recorded the whole thing, so you can go through it again. Or if you want me to go through any specific parts or any place where maybe I left off that you want me to go through again, I'd be happy to.
Now, since the resources are there, I think there is not much I want you to do. Just let me have the resources, and then I'll do that, the checking for myself.
Brilliant. Cool. So you'll find I just basically just the last bit I did there was go through the recommended readings I have at the end. And those are, I think those will be very helpful for you guys, especially if you're writing stuff or you want to advocate for things. But yeah, that's you guys have the PowerPoint now, so the slides, so you can go through that anytime, and you have all the links to everything. So yeah, let me know if you have any other questions.
Hello.
Hi.
Yeah. I want to know something because the last time I met with one PWID, he told me that he want to leave drug. So he want to leave drug, but the thing has already used to him. So if there is any drugs for him, or where he can go in order for them to treat him. But here now in Sierra Leone, the place that we have, when they take somebody there, they think that they are crazy people. So that is why I may want to know if there is any drugs or ways how they can treat them, because we don't have treatment center here. We don't have treatment center here, you see. Most of them, in some community, they explain their problem. It has been used to them since during the war, you see. But how they can try for them to be treated, we don't have treatment center here for them, because the Kisi Crescent, they are they may not like to go there. So that is why I said I may want to know, or how are we to do for them.
Yeah, I hear you.
Yes. Ishmael. Yes.
Yeah.
Can I come in?
Yeah.
Can I come in?
Yeah, of course, please.
All right, Ishmael.
Yeah.
I may not want to agree with you with the fact that we have a treatment center. We have one. You say the name behind the treatment center prior to this time was the problem, but the name has been changed.
That's what I said.
We have, I think, about,
because
yes, the name has been changed. The only problem
the name
is
has been changed, but
because
most
of
of them. Hello. The
yes,
name has been
yes,
changed,
I
but
understand.
most of them think that it is a Crescent still, because even if you
Yes,
explain to them, they said no, that area is a Kisi
no,
Crescent.
it's yes, I'm coming. It's your duty to explain to them that, okay, that's what you used to know, but there has been a development, and the name has been changed. In fact, if you go to the place right now as I'm talking, the way they treat them is quite different from the previous way they handle their cases. Now it's far. We can say the place is not sufficient. That's, I agree, because I think the government only provided 33 beds, which is not enough considering the amount of drug abuse we have in Sierra Leone. The 33 beds is not enough. I can agree with that fact. But you can still help the person to go there and be taking treatment subsequently, even though the person will not be admitted. if you want, I have the number of the matron. I think Juliana Cisse also has a number of the matron. At the name has been changed to Kisi mental home. It has been changed from mental homes to something. I have forgotten actually the name, but it has been changed. Yes, we went there the last with Juliana Cisse to do a kind of an interview with the matron. He actually explained to us the way they are now handling cases. Yes, there's a myth, or I could say people used to know the place as a mental home, but it has been changed, you know.
Hello.
Yes.
Hello, Alusain.
Yes, I'm hearing you.
Yeah, but yeah, you say this. Yeah, it's true because uh, I know the last time the president went there, what happens, that was not to my knowledge, in fact, because it was not on the TV
Okay, that's
station
what I'm
or
telling
neither
you
in the
now.
radio.
The
In the
government
radio.
actually provided 33 beds for drugs users. 33 beds. That's absolutely not enough. That I agree. What I can do, I will set up a time. The team will visit the place so that we have an idea about the way they do their things or the way they run the hospital. It's like an hospital right now. Um, different people are actually. They have people who have a mental issue, separate area. They have different type of people, I must say. There has been an improvement, absolutely. Though the bed provided is not enough. 33 bed for Sierra Leone, it's a very small amount. I can call the matron and book a time with him so we'll visit and try to know the way they do their things.
And it is
If that
only
is okay.
centralized.
Yes, I understand. Yes. I know.
Is it,
And Róisín, I think that's one of the issue. It's only centralized. We only have that bed here in the city. What about the interior, the provinces? We don't have, you know. We know,
Yeah,
but
this
that's
is really,
also taken into consideration. Yes, I was part of a 3 days workshop held by Institute for Drug Control and Human Security. All those issues came up, you know. I think the government is considering that strongly in their reviewing. I think that will come into play. They will want to add a new hospital or what increase the bed, you know.
because this person I'm talking of, is living presently at Kono, the Eastern Province. But I'll try to see how I can talk with him. Maybe the opportunity may be there for him to come over here in Freetown or not, but I don't know.
Okay,
Except I
okay.
try to connect with him.
Yes, what I will do, I will discuss this with the head of Institute for Drug Control and Human Security here in Sierra Leone to see how best he will come in to help. Yeah,
Okay.
I will have a talk
So
with him just
Róisín,
after
that's
the
all.
meeting. Yes.
yeah, and this sort of stuff is also very important. Like when you're seeing these things and there are like these massive issues, these are the perfect things to be advocating for, and you know you already are. It sounds like you're already there and doing it. Well, I would suggest, you know, like if the services are this poor and like there is like very, very limited accessibility, you know, I'm sure there might be some, I will do a little bit of research, but there might be some small like local initiatives in communities like smaller towns or other places that might not be like legal or government run, but trying to do some form of harm reduction effort. I don't know, but there tends to be some almost everywhere, and like there's some in like towns in Ghana and Nigeria and Liberia, where you have these really, really small groups of people who are just trying to help their community, you know. But I can see if I can find out some information, because perhaps maybe you would be interested in like trying to start some of those initiatives, or like this really on the ground basic stuff. It depends, and it is totally up to yourselves, because there's lots of risks involved with doing that if the government doesn't like it and that sort of thing as well. So I'll see. I'll get some more information and send it on to you guys to see, because yeah, it's really important when you're seeing these problems, and like I highly suggest you go visit that place and take a look at their practices, just like because maybe they need a change, maybe, you know, maybe they aren't suitable or they're not doing enough or whatever the thing is. And like, you know, obviously it's not them, the people who are working there, that's the problem. It's the amount of funding, it's the government, it's the attitudes and the perspectives. There's a lot of work to be done on sensitizing healthcare workers and that sort of thing in general. So yeah, that's what I would say, because it's really terrible when you have one individual that you are trying to help so bad and there is no way, you know.
Okay, I have remembered the name, Ishmael. The name is Kisi Rehabilitation Home. It has been changed to mental home to rehabilitation home. So I think you use that to explain to the person that they are now rehabbing people, not only people with mental issue, people with different kind of issue. Yes. But by and large, we will try to see how best we will help that person.
No problem. I will try to
Yes.
connect the person with the SSDP Sierra Leone chapter.
No problems.
Yeah.
Brilliant. So is there any more questions or comments or anything like that? I hope you guys have found this helpful.
Yeah, sure.
Yeah.
It's helpful. That's been great.
Róisín,
yes, I must say.
is help. Hello, Alusai.
Yes, sir.
Róisín is very, very helpful. When we go over the audios, if there is any question, we'll let you know neither on your SAP or in your mail. As for me, any question I have, I'll let you know earlier.
Yeah, that would be great.
Yeah, no problem.
Listen, I want to say I received the package, right?
Yeah,
last week.
yes, yeah.
Thanks for the package.
Yeah.
And
oh yes, the package.
Yes, yeah.
yes.
The only issue is, right, when because they're coming from the United States, they often take like 2 or 3 weeks, and sometimes they get caught in customs. I am sure Luis has a tracking number for it, because it's not me. Because
we've received it.
Oh, you received it. Oh, thank God.
Yeah. We received the package.
Yes.
Okay.
Yeah.
We go through. Yes, a lot of harm reduction materials. They are helpful. We'll use that to push forward.
Brilliant.
That I can guarantee you. Yes.
Fantastic. I've sent you information.
The t-shirt also is good. It's nice. We love the t-shirt. We love the writing there about harm reduction and some other areas, support, don't punish, some other areas, you know, that can help we to go far in the joining. Can help us.
Brilliant. Yeah, I will send you information because I have there's a way for you to apply for more materials when you need it, and I'll send you info on that. I think I might have already, but I'll give you a refresher.
No problem. No problems.
No problem. No problem. You're welcome.
Great.
We have a WhatsApp group of PW. But I will see. I will talk to the admin to see if he will add you.
Yeah, that would be great.
All right. I'll talk to the admin and see. Probably from now to Monday, that will be done.
Fantastic. Thanks
We
so
have a
much.
WhatsApp group. Yes, it's actually not created by us. It was created by the Institute for Drug Control and Human Security. Yeah.
Okay.
Yes, they have a
Cool.
group of people who use drugs, to share knowledge and the likes. We have brilliant people here, brilliant people who are into drugs. I must say, that guy says he is a journalist, though he may want to go low. As a journalist, he doesn't want other people, friends, to know that he is into this thing. So he prefers to go down low, though he has been helpful. He has been helping others, even to the workshop. He was the one that I was moderating the workshop. You cannot believe that.
Okay.
Yeah. But you see, I'll talk to the admin to see if I add you.
Yes, that'd be fantastic. Did any of you sign up for the Support Don't Punish workshop?
Yes, I did. I have just done that.
Oh, okay. And you got your invite and everything, yeah?
Yeah.
I will check my mail just after.
Yeah, I think because I know there was limited spots in it, but I had a feeling I thought I saw one of you guys' names on the list. But yeah. Well, I look forward to seeing whoever's there. And because we work with IDPC a lot, and they're so amazing to us. So I'm really excited for that youth segment.
All right, thank you.
All right. I think we can leave it at there for now, and I will send on the recording later this evening, so you can share it with all the members. And yeah, and hopefully I'll see you guys next Wednesday for the African Leaders Training. Make sure that you register for it. There's a link. I think it's in the WhatsApp chat. I'll send all of the things again, so you can have them fresh and at the top of the thing. I like the top of the messages so you can see it easily. But yeah, make sure you register for it. It's you have to register in advance to get the Zoom registrations and stuff like that. And I look forward to seeing you there because we'll have some really, really good speakers from the network.
All right. Thank you.
All right.
Thank you very much, Róisín.
No problem at all. Thank you guys for showing up, and I hope this makes a difference for you.
No problem. No problem.
Sure.
We'll try to make it up by Wednesday too.
Brilliant. I'll talk to you again soon, and have a good rest of your day.
No problem. Thank you.
You too.
Bye.
Alusain, thank you.
No problem at all.